In this script, we will explore the fascinating world of capillary structure and exchange. Capillaries are tiny blood vessels responsible for facilitating the exchange of oxygen, nutrients, waste products, and hormones between the blood and the surrounding tissues. Understanding the structure and function of capillaries is crucial for medical professionals, as it serves as the foundation for comprehending various pathological conditions and therapeutic interventions. Now, let's delve into the intricate details of each topic related to capillary structure and exchange. The endothelial glycocalyx is a layer of glycoproteins, proteoglycans, and glycolipids that coats the luminal surface of endothelial cells in capillaries. This structure plays a vital role in maintaining the integrity and function of the capillary wall. It acts as a selective sieve, controlling the permeability of molecules across the capillary barrier. The composition and thickness of the glycocalyx can vary in different tissues and under various physiological and pathological conditions, affecting capillary permeability. The endothelial cells forming the capillary wall are held together by specialized junctions that regulate the movement of substances across the capillary barrier. The main types of endothelial junctions include tight junctions, adherens junctions, and gap junctions. Tight junctions create a seal between adjacent endothelial cells, preventing the leakage of fluid and solutes. Adherens junctions provide mechanical stability by connecting the cytoskeletons of adjacent cells. Gap junctions allow direct communication and exchange of small molecules between neighboring endothelial cells. Angiogenesis refers to the formation of new blood vessels from existing ones. Vascular endothelial growth factors, VEGF, play a critical role in promoting angiogenesis and maintaining the integrity of existing vasculature. VEGF stimulates endothelial cell proliferation, migration, and the formation of new capillaries. This process is essential during development, tissue repair, and in various pathological conditions such as tumor growth. Pericytes are contractile cells that wrap around the endothelial cells of capillaries. They play a crucial role in stabilizing the capillary structure and regulating blood flow. Pericytes contribute to the formation and maintenance of the basement membrane, influencing the permeability and structural integrity of capillaries. Additionally, pericytes can contract and relax, controlling the diameter of capillaries and regulating blood flow in response to local metabolic demands. Hypertension, or high blood pressure, affects the hemodynamics of capillaries. Increased systemic blood pressure can lead to elevated capillary pressure, predisposing them to structural changes and impairing their ability to exchange substances efficiently. Chronic hypertension can result in capillary damage, promoting leakage and the formation of microaneurysms. These alterations in capillary hemodynamics contribute to the pathogenesis of various complications associated with hypertension, such as cardiovascular diseases and organ damage. Capillaries play a vital role in the transport of lipids, including fatty acids and cholesterol, to various tissues. Lipids are carried within lipoprotein particles, such as chylomicrons and low-density lipoproteins, LDL. Capillary endothelial cells possess specific receptors that facilitate the uptake of lipoproteins, allowing the transport of lipids across the capillary wall. Disruptions in this process can lead to abnormal lipid metabolism and contribute to the development of conditions like atherosclerosis. The blood-brain barrier, BBB, is a specialized capillary network that regulates and protects the central nervous system. It restricts the passage of most substances into the brain, maintaining the homeostasis required for optimal neural function. The tight junctions between endothelial cells in BBB capillaries create a nearly impermeable barrier, preventing the entry of potentially harmful substances circulating in the blood. However, certain small molecules and lipid-soluble compounds can cross the BBB through specific transport mechanisms. Capillaries play a crucial role in facilitating the exchange of oxygen and nutrients between the bloodstream and cardiomyocytes in the heart. The close proximity of capillaries to cardiomyocytes ensures an efficient supply of oxygen and nutrients necessary for normal cardiac function. Capillary density and integrity are essential for maintaining optimal cardiac performance. Any disruption in capillary cardiomyocyte coupling can lead to impaired cardiac function and contribute to the development of heart diseases. Diabetes mellitus is a chronic metabolic disorder characterized by increased blood glucose levels. This condition can lead to microvascular dysfunction, affecting capillary structure and function. The elevated levels of glucose and associated metabolic abnormalities can cause damage to the endothelial cells, basement membrane, and pericytes in capillaries. These changes contribute to impaired capillary exchange, decreased tissue perfusion, and the development of diabetic complications, such as retinopathy and nephropathy. Capillary leak syndrome refers to a condition characterized by increased permeability of capillaries, leading to the leakage of fluid and proteins into surrounding tissues. This phenomenon can occur as a result of the systemic inflammatory response, sepsis, or certain medications. Capillary leak syndrome can disrupt the balance of fluid distribution, leading to tissue edema, hypovolemia, and organ dysfunction. Understanding the underlying mechanisms and management of capillary leak syndrome is crucial for providing appropriate care to affected patients. Capillaries play a crucial role in drug delivery to specific target tissues. The unique structure and function of capillaries allow selective transport of drug molecules to desired sites while minimizing systemic side effects. Various drug delivery systems, such as nanoparticles and liposomes, exploit capillary permeability and transport mechanisms to enhance drug localization and efficacy. Harnessing the understanding of capillary-mediated drug delivery is crucial for developing targeted therapies and improving patient outcomes. In summary, the study of capillary structure and exchange is crucial for medical professionals and researchers. This complex field includes topics such as the endothelial glycocalyx and capillary-mediated drug delivery. Understanding these intricacies helps improve diagnosis and treatment of diseases, enhancing patient care and outcomes.